Josefina Contreras suffers from Parkinson's disease. And now 10 years later, she maintains a positive attitude and continues with her daily routines, something she couldn't do before because of her diagnosis.
So Parkinson's disease is a degenerative disease, right? It affects a specific part of your brain. Your motor needs to start developing your tremor or your rigidity.
The origins of this disease remain a mystery to many.
No one knows why Parkinson's disease, where it comes from. Some people say it's hereditary, some people say it was pesticides back in the day.
Throughout the years, experts have created treatments for Parkinson's, and one of those is called deep brain stimulation surgery, and it works as follows.
We have to put a halo on the head. That way we can identify the coordinates that are going to show me exactly the structure that I want to target when I'm putting my stimulator in order to get the desired response on the patient.
As was the case of Ms. Contreras, who was in the hands of Dr. Betancourt and Dr. Donis about a year ago.
I don't shake no more, and it helps a lot.
Ms. Contreras says she loves watering her plants and doing chores inside her home, something she couldn't do after being diagnosed with Parkinson's disease.
I have to sit down, and sitting down on the grass, I would clean my plants.
She kept her faith and knew that one day she would find a good treatment to cure her involuntary movements that weren't allowing her to have a normal life. On the second part of this special series, we will learn a little more on deep brain stimulation surgery, what it does, and how it changed Ms. Contreras' quality of life.
Welcome back. In tonight's Fox Special Report, yesterday we showed you the first part of a special series where we learned about a new surgical treatment that's helping people who suffer from Parkinson's disease.
That's right, giving them a better quality of life. In the second part, we will learn a little more on how it works and the outcome to one of its patients. Maria Perez explains.
Come here, baby.
In the first part of this special series, we met Josefina Contreras,
Que me acompañan todo el día.
a woman who has fought against Parkinson's disease for 10 years and has had to get accustomed to a different lifestyle because of this disease. Deep brain stimulation surgery benefited her quality of life. Let's learn a little more on how this procedure works.
First stage is where the doctor goes in and he'll make a small dime-sized hole on each side of the brain, right? And he'll insert a wire and then tuck them in behind the ear, all under the skin. So that's stage one surgery. The second stage, which is usually done a week after, is where the doctor will go in there and run 2 more wires from the back of the head of the neck to the chest and insert a stimulator battery pack like a pacemaker.
The patient is awake during the surgery under a light anesthesia. The tremor is so severe during the procedure, the neurosurgeon has to make sure that he sends the right amount of current into the patient's brain, this allowing for the tremors to stop.
Abra los ojos. Abra los ojos.
After DBS surgery, Mrs. Contreras claims she is happy and has seen a huge change. Now she can live a normal life and go back to doing what she used to do before she was diagnosed with Parkinson's.
I do a lot of things. I do everything. I wash dishes. I can mop. I can sweep.
Parkinson's disease is the most common in the elderly. Deep brain stimulation surgery is not a cure for Parkinson's, but it is something that helps improve their quality of life. Dr. Betancourt, how are you?
Hello, Maria. How you doing?
Doing well. Ready for surgery?
Yeah.
Let's go.